Go for it.
Okay, for digital x-ray on the Imago, this is the home screen to enter a new study. So what you'll do is you'll click on new study. Regardless of what's here, you're going to hit this little spike ball down here to add a new owner, and that resets all your information. So on this one, we're going to do test 2. And then the name, so family name is your pet's last name, first name is your client, and then every time you're done, you hit the disc, and it asks you if you're right, ignore that, and just say yes to save new owner, and then it'll ask you to hit OK. It does that for each block. So over here for this, you're going to enter the patient name, and then you're going to enter the 4-digit or however many digit you have patient ID number. You're going to hit the disc, say yes, say OK. Over here, visit information. All of this can be just per the patient. So this one, I'm just going to say test, but you can say gunshot wound, you can say possible GDV, whatever you want. Hit the disc, say yes, say OK. Down here is the study information. It's what you're going to be doing. So I'm saying test x-ray, test DR. And this one you do like thoracic x-rays or abdominal x-rays. Hit disc, say yes, say OK, and then selecting your doctor. Default everything to Dr. Pullen. I'm not going to add in every ER doctor right now, so just default to Dr. Pullen. And this arrow in the bottom right corner, that takes you to the main Epica screen. So this machine does digital x-ray, fluoroscopy, and CT. For the next little bit, we're going to use it as digital radiography, so just click on that. Just make sure you're defaulting to that. You'll hit start in a second, but over here you're going to select the green dog, which has to do with your patient selection. So in this screen here, you're going to make sure that all of this information is correct. Your patient ID number needs to be correct. Owner's first name and last name need to be correct. Patient name. Birth date is slightly important if you're going to send this off as a report. So just make sure species, breed, and then your weight, all that's the same. Clicking on this kitty cat right here, if you click the mouse on the body and you left click, it'll take you to different size animals depending on their kilogram spectrum. So make sure you're selecting that right, because that changes your KVP and your MAS and all that stuff for your, like, you guys know, penetration, all that. So right now I'm just going to select less than 5 kgs for my test study. Clicking on this dog down here in several areas will also take you to different anatomical areas. Obviously chest, you know guys what to select. So for now I'm just going to do a test on my abdomen. And then this right here just talks about the positioning of your patient. I actually don't know how important this is going to be. I would still prefer you guys putting a marker in the image. But also if you can try to make this match how you have your patient laying, that would probably be best. So just letting you know that. So right now I'm just going to click it and leave it on the default of when I first turn this on. Clicking on the green dog makes that go away. And this list right here will show you any images you've taken already so that your doctor can review it. Obviously all of mine right now are CTs and fluoroscopies. So we're going to hit start, and that's going to warm up the gantry and warm up everything for me to be able to do it. Once the stop thing comes on and it says keep the foot switch pressed, you're ready for your x-rays. So over here, this is my cat that needs an x-ray. You're going to line it up with the cross beams. I'm going to keep these turned off, but the only place to turn the cross beams on and off on this machine is located right here where it says laser on and off. So it's best to keep them off while you're not needing to know positioning. But for positioning, if you turn it on, you find your crosshairs. Your crosshairs is going to be the center of your image. So for instance, if you're doing chest films, you want to find your heart and kind of center yourself there, and so forth. Table height gets moved only right here. So you want to make sure that your crosshairs are going right through the middle of your subject, that they're not too high, too low. So table height is here, and then to move your table forward or backwards, there are arrows that say back and forwards on this screen too, if you need to move this around for different positioning and stuff. So once you have your image centered and you're ready to go, it is best if you can remember to turn your lasers off, and then you're going to come over here. The foot switch down here on the floor, you're going to hit and hold, and then if you'll direct the camera back up to the screen, it says keep foot switch pressed. It will tell me when to turn it off. Okay. There's my image of my cup. I'm directly in the middle, and I am done and good to go. When Dr. Pullen comes to look at that image and he tells me it's perfect, I'm going to say OK to archive by double clicking in that window right there. You see that again? So it'll say yes, and in the note I'm going to double click and a pop-up window comes over here, and I'm going to say test. You could put left lateral chest, right lateral chest, VD chest. It helps, you know, it's an extra labeling way. So you just hit OK. Once you're done and you want to send your images into the main hard, I guess, not the hardware, but the main memory of this computer, you're going to highlight the image just by left clicking on whatever you want. You're going to highlight that image and you're going to hit the square with the arrow, and it's going to ask you if I'm sure I want to save this study. I'm going to say yes. It goes through and checks to make sure I didn't mark any other studies from the past, which I didn't. So once we're done, my test is going to be right up here. If your doctor wants to review those again, you're just going to double click on it, and it's going to take you into the screen where they can be manipulated, zoomed in. You can turn, you can do all sorts of stuff. You can even do a 3D rendering if you wanted to, but you don't need to. So anyways, that's just another place for your vet to view that. When you're done, you just hit this arrow here, and it'll take you back to this screen. From here, what you can do, I'll actually have everybody leave me a note as far as what needs to be put back into records, and I'll do that the next business day because that is a whole nother training in and of itself. But otherwise, that's it. And if you guys have questions, text or call me and I can help you guys out. But that's it.
Thank you.